Good afternoon, everybody, and welcome to this super webinar, Return to School Guidance, Child Find and Early Intervention Services. We have OSEP representatives doing the presentation. So thank you for joining us. To interact with presenters, there's a Q&A area that you can click over there. And we also have the chat, but the questions are in a better posted on the Q&A. And okay, we also have closed caption available. You need to click where it says CC over there, and then you will have the captioning. And then we also have an interpreter here, Guillermo Cordero. So, si les hace falta interpretación al español, por favor hagan clic en el icono de interpretación, seleccionen español, Spanish, y después de seleccionar español, hagan clic donde dice Mute Original Audio. And then I will pass it to Jennifer Miley.
Thank you, Miriam. Good afternoon, everyone. My name is Jennifer Miley, and I am an OSEP Part C State Lead, as well as the MSIP Lead for Family Engagement. And my colleagues and I are very excited to be here today, per your request, by popular demand, based on the December 2021 guidance, OSEP guidance call. So thank you so much for inviting us. And I've had the pleasure of working with Carolyn in the past, as well as participating in a number of parent center meetings. And it's always been a really great learning experience. And we really appreciate the opportunity to begin 2022 with further collaboration. And I also want to thank my RTP colleague, Carmen, who's always wonderful about making sure that MSIP is included in the loop, and we are supporting the parent centers in SIPR as much as possible. So without further ado, as I said a few seconds ago, we are here, my colleagues and I are here to present the guidance on Child Find and IFSP. And joining me today is Brenda Wilkins, Jennifer Barrett-Zitkus, and Jeanette Guerra. I'm sorry, Jeanette, if I'm mispronouncing your name, as well as our OSEP policy lead, Lisa Pagano. And I think you guys received their bios. If not, my colleagues are free to share their bios as they begin speaking. And we do ask that you hold your questions until each presenter has completed their presentation. And you can also have, the option of putting the questions in the chat, and I will monitor them, and we will get to all of your questions at the end. So at this point, I will hand it over to my colleague, Brenda. Thank you guys so much.
Thank you, Jennifer. Can we go to the next slide, please? Okay, so I wanted to talk to you about the recent guidance that OSEP issued in October about Child Find. It's the Child Find guidance. It addresses 4 different questions, and this Q&A document basically highlights under Part C of IDEA that each state lead agency and its early intervention service providers are responsible for implementing the Child Find system in their states. And they're responsible for identifying, locating, evaluating as soon as possible infants and toddlers with disabilities birth through age 3 who may require early intervention services. So as I said before, it highlights 4 different questions. So the first question is, if a referral was received, but a family was not contacted due to the pandemic. And this basically highlights that the lead agency or EIS provider should give high priority to identifying and contacting those families that were not contacted during the pandemic. It also highlights if there was non-compliance that the state must correct the non-compliance based on OSEP's 0902 memo. And lastly, if a child did turn 3 years old over that course of the pandemic, that the lead agency and EIS provider should work very closely with our Part B or SEA or LEAs to assist them with their child find efforts and linking those children to Part B. Question 2 is if a parent declines consent to an evaluation or consent to Part C services. And this basically highlights whether it emphasizes that if a parent declined an evaluation, the EIS or lead agency, they're not required to conduct an evaluation. However, we are encouraging the EIS and the lead agency to reach out to those families. And if a child turned 3, to please reach out to their Part B counterparts, just to make sure that those alliances are still, those linkages are still made between Part C and Part B. Question 3 talks about if the parent provided consent to the evaluation, but the evaluation was not conducted. So question 3 really highlights that the EIS or lead agency, they should prioritize those children, reach out to those families and see if an evaluation is still wanted by that particular family. So that's very important when in those particular child find efforts. And then the 4th one talks about virtual screenings and evaluations. And basically, yes, states should have virtual options for parents. So if a parent decides, yes, I want to have my child screened virtually or an evaluation virtually, then yes, they should be able to provide those services. However, there is a caveat. We want to make sure that the state has policies and procedures in place for screening and evaluation, and to make sure that those screening and evaluation tools yield valid and reliable results. So that's very important to make sure that we get the best data possible when we're screening and evaluating children. And additionally, the Q&A does highlight the Part C Child Find Self-Assessment, which is a tool that states can utilize to assess their child find system and develop best practices to reinvent or strengthen their child find efforts within their state. Next slide, please. So the Part C Child Find Self-Assessment is, like I said, designed for EIS or lead agencies to really take a deeper dive and look at their child find system. We want to strengthen their child find system, which is the basic reason that we developed this tool. It is divided into 4 sections, and it has 7 best practice theme areas that states can utilize. It is completely voluntary to utilize, and you don't have to fill out all of the best practices, that you can take those best practice themes that best align with what you're doing within your state. So these themes are collaboration with primary service providers or service referral sources, identification of infants and toddlers who are underserved in Part C, the evaluation of child find, data systems, technical advocacy of screening and evaluation tools, which kind of ties into the guidance that we issued in October. And then lastly, the efficiency of screening, referral, and the evaluation process and procedures. So it's a very effective tool that states can utilize now. Next slide, please. So OSEP is going to be issuing a 619 self-assessment for preschool agencies as well. So the purpose of it is to support programs in establishing an efficient and effective child find system. It is very similar to the Part C child find self-assessment and the funnel tool, because we wanted to be as consistent as possible so states aren't relearning different tools as they look into their system. The best practice themes are very, very similar to the Part C. They include cross-sector collaboration, data systems, technical advocacy of screening and evaluations tools, tools, but it's not limited to that. There's also 7 different best practice theme areas. And it's also divided into 4 components: regulatory, best practice, technical assistance and resources, and then there's OSEP policy letters and guidance that can help states navigate their child find system. Next slide, please. So DAISY has issued a meaningful difference in child find tool. They issued this in 2018. This resource is a very great resource that provides an Excel-based calculator that allows states to make several comparisons related to the percentage of infants and toddlers served, state percentages compared to state targets, local program percentages, and compare those percentages to state targets. And then it provides year-to-year comparisons of the state percentages as well. So it's a very effective tool that you can utilize along with the Part C, the self-assessment as well. Next slide, please. So this is the Child Find Funnel tool. It is a very effective tool that DAISY also developed. It is also an Excel template that is utilized for displaying data about infants and toddlers at each step of the Part C process, from referral through exit. And you can utilize this tool for a set of infant and toddlers referred within a specific time span. So it's very effective that way. So you can enter it on entry data on the worksheet. You can enter the data from the entire state. You can enter local program data, or you can enter data from one or more of the subgroups. And you can use this to create the actual funnel tool so you can see the children through entry through exit. So it's a very effective tool as well. I also wanted to go back to the part, the 619 self-assessment. I want to put a big drum roll. We will be rolling out the 619 self-assessment during OSEP's National TA Call on March 10th, 2022. And we will go into more detail about the 619 self-assessment tool. And so I hope you all can join us during that time. Next slide. So these are just the resources that I just highlighted during my time with you today. This is the Part C Child Find Self-Assessment. And then with the Part C self-assessment, you can also see there's a Child Find Self-Assessment Quick Access tool, which helps you kind of pinpoint those areas that you want to highlight when you start using this tool. And that will be it for me. I'm going to turn it to my colleague, JBZ, or Jennifer Barrett-Zitkus. JBZ?
Thank you so much, Brenda. And you could move us to the next slide. That would be great. We have a number of Jennifers in our office. And so I go by my initials. I promise my mom and dad didn't name me JBZ, but it does flow quite well. And I'm just honored to be here today with you, and thank you for all the work you do. And we recognize nowhere have we ever planned for such a challenging time as the pandemic. And in 2020, we would not be ever thinking we'd still be talking and dealing with this COVID-19. And this guidance that came out in October, what I'm going to be talking about and then passing it to my colleague is around Part C IFSP guidance. And it too matches with questions, frequently asked questions, but know that it's going to focus on the development and implementation of the Individual Family Service Plan, or the IFSP. It also builds on previous guidance that all timelines and requirements remain in full effect, including those for children and families receiving early intervention through an interim IFSP, as some states may have chose to address that with an interim IFSP. We also acknowledge that the pandemic has impacted the physical, social, and emotional health of children and families across the nation, and that the IFSP team needs to consider how the family's capacity to support the needs of their children or child may have been and continue to be adversely affected by traumatic stress brought on by the pandemic. What we do know as well is that families were under stress prior to, and the pandemic has brought additional stressors with unemployment, health concerns, and so on. As always, the IFSP team, which includes the family, we stress that the IFSP team needs to continually assess the child and family's unique needs and situations to ensure the most appropriate and individualized IFSP services are identified and provided. We also reinforce that frequency and method of service is the IFSP's decision, again, including the family, based on information gleaned through assessment activities, evidence-based practices, and in accordance with state and local and state policies and procedures, not to supersede the Individuals with Disabilities Act. I'm going to now pass this on to Jeanette, and the next slide for her will be great.
Thank you, Jennifer. Good afternoon, everyone. This guidance also addresses compensatory services, specifically in questions 3, 4, and 7, stating the need for the lead agency and early intervention service providers to review data to identify services, both ongoing IFSP services and transition services that may not have been provided, as well as updated assessment information related to the child's progress towards the results or outcomes identified in their IFSP. Then through that IFSP review process, determine whether and to what extent compensatory services may be needed to address service disruptions due to the pandemic. And these decisions, of course, are individualized and based on updated assessment information for the child and family. In regards specifically to transition services, early intervention service providers are strongly encouraged to work closely not only with Part B to fulfill required transition activities for those children who are eligible for special education preschool, but also with community early childhood programs for those who are not eligible for Part B and may be transitioning to other programs. We know that smooth transitions take extraordinary collaboration under normal circumstances, and so we'll continue to take even more extra efforts and cooperation in these remarkable times as programs are returning to or are in and out of in-person services at varying stages, and when programs have differing policies that influence those practices. That being said, in question 8 in the document, we also want to urge states to take this time as an opportunity to look systemically at their transition process and procedures and to identify strategies to build infrastructure that supports a seamless system of service delivery. This might include developing or revising MOUs or interagency agreements, possibly looking at Part C eligibility and considering serving infants and toddlers who are at risk if they don't already do so, possibly exploring the extended IFSP option, and or building workforce capacity in infant and early childhood mental health, to name just a few considerations. It certainly includes considering how supplementary funds such as those from the American Recovery Act plan, ESSER and GEAR might be utilized. Finally, in question 6, it reminds states of their obligation to report any non-compliance data and correction of non-compliance in their annual performance reports. We do want to mention that the last question in the document also references some health and safety related resources from the CDC, but we'd also like to take some time today to share a few other resources with you specific to the implementation of IFSP ongoing and transition services. Next slide, please. So these resources are not new, but they remain relevant, and we just wanted to take this opportunity to remind folks of them. The first one is a training package that was developed collaboratively with staff from the ECTA Center and the Western Regional Resource Center in response to the need for from states and local providers to have specific information and resources about developing high quality, functional IFSP outcomes and IEP goals. The second one addresses reviewing existing documentation and can be used as a checklist during transition planning to gather key Part C information for consideration during the Part B evaluation and eligibility determination process. Families and Part C programs have a wealth of information to share during a transition planning conference, and it's vital to gather all available information to establish eligibility and develop a high-quality IEP. The challenges we've experienced during the pandemic have certainly required programs and providers to be innovative in seeking information and obtaining documentation. This tool might be a useful tool to identify ways to decrease duplicative efforts that make way for more timely and smoother transitions. The next one, late referrals to IDEA Part C, is a chart that illustrates the Part C and Part B requirements and timelines, and the roles and responsibilities of each program within 3 referral time periods. So those referred less than 45 days, those referred and determined eligible between 46 and 90 days, and those determined eligible between 91 and 135 days. There are lots of details in this chart. And then finally, the early childhood transition timeline for SPP APR indicators C8, A, B, and C, and B11 and 12 is a flow chart that illustrates the required steps and timelines for Part C children determined eligible at least 90 days prior to their 3rd birthday. And next slide, please. We also want to remind everyone of resources related to the DEC, the Division for Exceptional Children recommended practices. There are improvement tools for each recommended practice topic area, including families and transition, on the ECTA website to build the capacity of practitioners as well as families. And the tools consist of checklists, both video and written description illustrations, and 2 sets of practice guides. There are also online modules developed by the Early Childhood Recommended Practices Modules Project that takes participants through the Plan, Do, Study, Act cycle to learn about, implement, and make improvements to their practices. And finally, the National Center for Pyramid Model Innovations, or NCPMI, has truly a wealth of information and resources for programs, and a whole section specific for families. We know that children and families' social and emotional well-being have been impacted by this pandemic. So we want to help get those tools into the hands of families to know how to promote their child's and their own wellness. As always, we highly encourage your use of the many tools developed and available through our fabulous TA centers, as well as engaging in conversations with their representatives, with OSEP state leads, to support implementation of recommended practices within early childhood programs. And so with that, I'm going to pass this back to my colleague, Jennifer.
Thanks, Jeanette. That was really helpful. If you wouldn't mind moving to the next slide. We know that we've given you a lot of information and a lot of resources. And I saw in the chat earlier, people were asking, of course, you'll have a copy of the presentation, which has the hyperlinks to the resources that were mentioned by my colleagues, as well as I heard that this presentation is being recorded. And with that, I haven't gone back really far, but just to open it up for questions that you may have on the information that we've shared today.
Busy. I went all the way to the beginning and back, and I don't see any yet. But
That's okay.
I don't see any questions on the Q&A area either.
Can I jump in with just a couple of things?
Of course, Lisa.
Sure. I'm Lisa Pagano, as you heard in the beginning, and I help to support policy. Some of you may remember me from past presentations that we did around the release of the Part B documents. I just wanted to express my appreciation for the important roles you have in supporting families. And even though we don't necessarily get a lot of complaints and a lot of calls about Part C, I think you're in a really unique position that when you're supporting families of infants and toddlers with disabilities, that you're in tune with some of the challenges you've heard about today. If you take a close look at the guidance, you'll see that OSEP is really challenging Part C programs to re-examine their child find efforts, to look at things through an equity lens in terms of their efforts to make sure that they're reaching maybe families who have not, been accessing Part C services. With the challenges of the pandemic, unlike Part B, but in Part C, and help me out because these guys are more the expert in Part C than me, families can say thanks, no thanks, right? With Part B, we don't see that very often because, children are going to school, but with Part C being more of a voluntary nature, you know, parents may have said no to Part C services and maybe continuing to say no because of COVID-related, pandemic-related concerns. And I think that we really want our Part C programs to be challenged in checking in with parents about, what's the reason you don't want the services? Maybe we can come back, or maybe we can find another way to deliver those services, whether it's virtually or telephone consultations. If families still are not comfortable having someone come to their home. So I appreciate all the work that OSEP's Part C team has done, and particularly the colleagues on the line today in leading the effort to answer some of these really challenging questions, particularly around compensatory services. For Part C, that's not something OSEP has really talked much about. So I hope you'll pay close attention to Jeanette, I think you covered that particular question in the Q&A, because again, I think sometimes folks think, well, children are in the Part C program for such a short time. Is that something that's really relevant? And in the case of those young children who are transitioning or should have transitioned from C to B, but because of lapses due to service disruptions, it's really going to take that strong partnership between the LEA and the EIS provider to look at, how to get that child transitioned appropriately, and if there are any compensatory services that might be due because of that untimely and smooth transition that IDEA requires. So I think that's it from me, unless
Thank
somebody
you,
has a
Lisa.
question.
I was gonna, while we're still waiting, I'm gonna just chime in to say, one of the things that early intervention, has the most vulnerable population, obviously, with infants and toddlers and their families, and usually early, just finding out possibly that your child has a developmental delay or potentially a developmental disability. Early intervention providers and programs pivoted, which I promised I wouldn't use that word too many times because we've just all been pivoting quickly to continue to provide via services virtually, but many families, for the reasons Lisa mentioned, may have decided to pause to take on all the other responsibilities that were coming to them with other school-age children or job or their own health issues. So we definitely would, it's important for families to understand that even though they may have said no once, that doesn't mean no forever. And some of the preliminary information that we have on development of young children is that this pandemic is showing an impact. So the work that Brenda has done and sharing today with you around Child Find, the referrals had gone down. They are starting to peak back up, but we want to make sure that Child Find is an awareness that there are programs, but also identifying children who could potentially be experiencing developmental delay or disability. I think there's a question in the chat. I'm sorry, I was talking, and our parent center is hearing there is a lack of staff to provide services in a timely manner. Provision of service, timely provision of service is a requirement, and states report on that. And yes, we have been hearing the same thing around provider shortages. Early intervention has, in different states and different locations within states, has experienced provider shortages prior to the pandemic, and they continue to experience those provider shortages. The local program and the state has a responsibility to provide the services that are on the IFSP. So again, the guidance that Jeanette spoke to around compensatory services, if they haven't identified a provider, they do need to, that there is that lack of, and it is a priority of this administration. And even we have been working on attracting and recruiting and retaining providers, teachers as well. Yeah, provider shortages are big here. I think you're exactly right. I think the teacher shortage and provider shortages are there. It's important, while we recognize the difficulties, there is still a responsibility, and we're working really hard to support states as they continue to try to bring providers to their area.
I know it doesn't solve the problem, but we've certainly in the department been emphasizing the additional funds that have been made available to perhaps give incentives, rewarding providers, trying to contract with, with folks to help meet those shortages. But we know that money is not the only, that's not the only factor, but there is more money.
And I would say that that's why we lean so heavily on the parent centers. We don't want families to give up. We know that states have won their oversight responsibility, and local programs are trying very innovative work, looking at ways to address the individual needs that are identified on the IFSP or an IEP, and then making sure they are able to identify a provider through either, I know prior to the pandemic, many states had been utilizing tele-intervention as a way to get to those rural areas where often they're combined with a rural area, but also fewer and fewer providers. And some of those states were able to adjust quicker because they were already putting things in place. Yeah. They know how to.
Well, and remember, when we talk about compensatory services, I mean, it's not like necessarily better late than never, but that is a reason for a service disruption, lack of a provider to deliver services to an eligible child.
You're exactly right, Roberta. The balance of COVID considerations and provision of service. I think, having, not worked in the field for many years, many of my children that were on my caseload were medically fragile. So how can we address that? I think that's important. I'm going to see if my other colleagues have anything they would want to add.
Jennifer, I echo everything my colleagues have said, and I just wanted to touch on when I participated in a couple of the parent meetings last fall, and you guys, as many of the concerns that you guys are sharing today, you also shared then. So we really love hearing from you. And I think one of the things that I took away from those phone calls is that the important role of the parent center and how so many families really, reach out to you and depend on you. They feel more comfortable in often situations, they feel more comfortable reaching out to you than to voice their concerns to the state. So I want to, give you kudos to that. And even in these distressing times with COVID and the pandemic just raging, we want to encourage you to continue to do that. And it's also distressing to see a number of the comments where some Part C families have given up because of the challenges they face in the program. So please remind them that they also have, as was mentioned a few minutes ago, the dispute resolution options. And we would love to see the Part C dispute resolution system exercised far more than it is. And that's one of the things that I'm looking forward to reviewing in this year's APRs that actually came in yesterday, to see if the data regarding the dispute resolution has changed in Part C. So, because it has been no to none for most states, which is somewhat concerning. Thank you.
Thank you, Jennifer. I was actually going to say the same thing, that while we recognize that programs are stretched so thin and they are doing their very best to meet the needs of children and families, and we don't want to minimize the challenges that they're facing. We also, though, want to remind parents and families that they have rights. And like you said, we rarely see those rights exercised through the due process system in Part C. So we know that it doesn't accurately reflect, the frustrations, because parents do get tired and they just check out rather than going through those processes, which takes, additional time and effort that they're already weary from just getting through the pandemic in this case, and learning that they have a child with a delay or a disability. So yeah, we want to make sure parents know their rights and that they know the channels to go through to exercise those rights and get what they need for their children.
I just wanted
Knowing your
to-
rights and exercising your rights are really critical. Brenda,
just
were you
wanted
going to
to-
address the question in the chat?
No, I just wanted to say that I'm also on the DMS monitoring team, on the implementation team here at OSEP. And we will have, as we monitor, we will have a stakeholder engagement piece where the PTIs are, really an important stakeholder that we will also have. I think we're exploring that. So I just wanted to let you know that we're gonna see if we can kind of have the PTIs in that stakeholder piece as well. That's what we're exploring that.
Right. Thank you. Lisa, I don't know if you want to address the question. I'd be happy to as well. It's in Virginia around families being told at the local level to wait to go into the early childhood special
my.
education program.
I'll let you go ahead and take that one.
Thank you. Well, I'll let you jump in at any
Sure.
point, of course, with my colleagues as well. Is one thing to know, and this you may be already aware, is that OSEP doesn't monitor at the local level. Our responsibility is monitoring at the state level. So while this is concerning when we hear something like this, the state has a responsibility for that oversight. And while the processes seem lengthy, trying to help families understand that they do have a right to the services when determined eligible for early intervention. And while that may be a reason, it's not a rationale, and it would be non-compliance if a family wanted to pursue early intervention. There's only a really small window. It's that less than 45 days to their third birthday that we would send them on to their LEA or the SEA for an IEP, an early childhood setting. So I think the question is knowing your rights when you're and then exercising them, but also the time it takes to raise very, very young children. We know that there's the barriers there. And so they may not know to reach out or how to reach out or have the time. So I think Jennifer Miley has talked a lot about how we can get information to families. All service coordinators that are working with families are given their rights, but understanding what that means beyond the paper is, kind of getting that connection with another parent, knowing they have that. But in this case, this is really at a state level responsibility for oversight, though it is concerning because children should receive services when eligible for early intervention in that setting.
Yeah, and Virginia you are in a unique situation of having children or the option of transitioning early to Part B. On one hand, we've been really promoting the availability of the extended Part C option, to allow children to remain in Part C for a little bit longer if that seems to be what would be good for the parent. There are just a few states, I think, that have taken advantage of that option. But yes, in Virginia, there is the option to transition to Part B earlier. I would think that because of the lack of providers would not be an appropriate reason necessarily to do that. And probably part B is saying, we don't have providers either. But yeah, that is a different circumstance. And it is one that's, yeah, states can choose to do. IDA permits that.
Right, as long, you know, the parent is on the IFSP team and the on the IEP team as well, and so they should be part of that decision making. So understanding understanding that they are part of that decision making, you know, choosing that. When we have a number of states now, Connecticut being one, DC and Maryland are longstanding that provide early intervention services beyond the age of 3. New York also is one that allows children to transition early to early childhood programs. I'm sorry, I'm looking at that question. So.
Yeah. I wanted to respond to the issue about dispute resolution being challenging to understand and kind of complicated. And to the extent you have not looked at or had the opportunity to look at Cadre's website, which I'm sure you guys know Cadre, they are our good friends who help support appropriate dispute resolution in special education. They have developed a nice series of guides written specifically to help parents understand the various IDA dispute resolution procedures. And there are videos that accompany those guides. And I think so much of them, we actually use them for training, even with our own staff in OSEP. So if you haven't taken the time, I know it seems like, oh, you know, when am I going to have find time to look through these things? But I think once you took the time to look at the guide and maybe watch the 5 or 6 minute video that they have accompany those materials, I think you'll reach the same conclusion that I did, is that these are really valuable materials that can help families better understand. You know, it's still intimidating. A due process hearing is, you know, a legal proceeding, and that's always scary, but it becomes a little less scary when you know what to expect. And I would encourage you to take a look at those materials, and please feel free to share those with families as you find appropriate.
All right. I'm looking, Lisa, at the question that Ms. Johnson Law has posed around supports that OSEP offers to state agencies in implementing oversight, that oftentimes there's an oversight issue and a reactive issue. Brenda Wilkins mentioned the differentiated monitoring system. So OSEP has a responsibility. Actually, we're all representative of the Monitoring and State Improvement Division of OSEP and OSERS. So states have, they make assurances to provide the oversight and monitoring. They also, then we will be monitoring states to ensure if we, you know, again, if it's a local issue, the parent would raise that at the state level, either through a state complaint or through a due process hearing. You know, and while we have a number, Cadre being one, but we also have other TA centers that provide supports to states. I'm not sure of the reactive issue. I don't know if you want to go off mute and explain what you mean by that. I don't want to read into it, and or if Lisa wants to add anything to that question.
I'm sorry, I'm multitasking looking
That's okay, no worries.
Diana's question that I see. Hi, Diana.
I don't know.
Sure. What open question are we on right now? I'm sorry.
I had just addressed like what OSEP does to support states in monitoring. She had Ms. Law Johnson Law's remarked that there's a reactive issue, an oversight issue, and a reactive issue. I wasn't sure I was clear on that, but I think I answered it to the best of our.
Yeah, one of the things that we're really trying to push states in our conversations with states about doing is being more proactive and having ways to gather information to know what's going on in their programs, as opposed to, oh, it's time to develop our SPP APR. Let's go look at what our data are, and then report on those. We've been messaging the importance of technical assistance and staff development. I don't think we think anybody sets out to do the wrong thing for children and families, or to not follow a requirement. For the most part, there are some bad eggs, I guess, out there, but that with good technical assistance and professional development, some of the non-compliance can be avoided. The failure to provide services because of lack of people to do that, I think that's frustrating for everybody. And there are a lot of folks who know that there are kids who are not getting, what they're entitled to now. I know we have promoted, and I'm sure you do too, honest conversations with families. No sense pretending you're able to do something that you can't, no hiding the ball. But by treating, families with respect and coming up with a plan about, what may be able to be done now, what may, developing a plan for maybe making up services that can't be provided right now. Those are some of the things that we would hope would be occurring. So, we get data through APRs, and states have to follow up certainly on that. Brenda talked about our monitoring. I will tell you from time to time, you guys may know I support our customer service team within OSEP, and we have had situations where we have had issues kind of bubble up from customers who contact us to say, these things are going on in our state. It's not right. Is there anything you can do? And that we have, done some additional sort of targeted looks at things when we get that kind of information. So I know with COVID, folks aren't so much, boots on the ground monitoring on site, but we have said that the responsibility to still oversee, to still hold accountable, all of those things are still in place. There was no waiver of IDEA's requirements for general supervision for either Part C or Part B.
Yeah.
I just
I see what.
wanted to- I'm
Oops,
sorry.
go ahead. I'm sorry. I was just
wanted
going to. Diana Austin has a question or a comment in the Q&A section. So.
Yeah. Oh, says the question has been answered live.
Well, no, I was just about to.
Yeah. Oh, okay. Go
I was
right
just
ahead.
about to. And I do think this is, such a key, the big difference between knowing your rights and being able to exercise. And we mentioned that, or families who English is not their first language, or they have no way to keep, or have a disability themselves. And the kind of assumption or stereotypes about parent centers being adversarial. Early intervention is, and I think everyone, with the exception of Lisa, I spent all of my life working in early intervention as my colleagues here. And it is a really special relationship that providers have with families, and they're hesitant to make those concerns known until a relationship goes really south, and it's a short time. So I think that early intervention is required to have an interagency council, a state interagency council that should have representatives from families or of parents. Local programs also, I know in a number of programs I had parent representatives to help have, walked in those shoes before and know what it's like to have a child have a diagnosis or an IEP or an IFSP. I think we have, states have responsibilities to report in their state performance plan and their annual performance report. We've been talking SPP, APR abbreviations, but in there we have a family survey. Jennifer Miley is our expert in working with families, and we're asking and holding states accountability to have a wide stakeholder that represents all families that receive services. So I do think, as well as family outcomes. We want to know how families understand their child's development, as well as how they understand their rights and help their child develop and learn. So we do have points that we're looking at. Some are compliance indicators and some are results. The ones I've mentioned were results indicators. So I do think we want that connection, but it's going to have to happen at the state level and the local level. And the local level is the ground level where you guys are. And I know that Jennifer and Carmen have a number of plans to continue to collaborate with you. So
I would just add, we've talked about encouraging states to really look at their child find efforts and the effectiveness of their child find efforts. I think, sharing information about parent centers with young children during that process would be, completely appropriate. And whether you guys are able to sit on your local interagency councils, your state interagency court, SICC, State Interagency Coordinating Council, to have that kind of input about where are places that it makes perfect sense for parent centers to be part of that conversation with families of young children. I know you guys stay really busy with Part B. Go ahead, Brenda.
Oh, I just wanted to go back to a question. I think it was Ms. Law asked earlier. As far as the DMS process, we are exploring a local component to our monitoring because we feel that there is a need to not only monitor the state, but just make sure that those policies are put into practice. So we are trying to develop, or in the process of developing, a local component. This is, this new cycle of DMS is really new, but I just wanted to just let the audience know that we were planning to do a local component, and that it's a very important piece of this monitoring cycle that we're going through, and probably more during phase 2 of our monitoring.
Yeah, this is a really rich conversation, and one that I'm really passionate about. And I just wanted to add that note so that other participants can ask further questions. But I do think that oftentimes some Part C states do view a complaint or a concern as negative, when in fact their systems have been pretty dead for years, and they should embrace the fact that a parent has a concern and want to take it forward. And one of the things that I've heard consistently since I've been with OSEP from states is that the child is here for a short time. The parent just wants their children to get the services and move forward. And some states really won't push. They won't push any further than that. So with the parent centers being one of our key partners, along with states, we really encourage you to remind Part C families that, of their dispute resolution rights, and states should be supporting them and helping them, access the dispute resolution system, and not just when issues arise. They should be informed of it from the first time that they touch base with them, and throughout their time with the Part C program, regardless of how short it is. And I believe that if families are not informed of their rights, know anything about their opportunities, to access that system in Part C, they will not use it. And many families, as you guys have said in the chat, they are completely unaware of their right to, dispute a service, ask for additional service, file a complaint. I mean, and in the pandemic, we should see a number of complaints, many complaints from both Part C and Part C, because we've heard directly from you as well as from our customer service, and we hear it in the news every day. The lack of services, the challenges of services. So we're in a partnership with you, and we really encourage you to push the envelope. Hope I don't get in trouble for saying that.
You're just recorded, Jennifer.
Yeah, you're just recorded. No worries, Jennifer. I did want to point out in the Q&A that they were talking about having, monitors or mentors that speak Spanish. We need advocates that the Department of Ed line doesn't have support for families with diverse language needs. This is the Department of Ed in a different state. And a question, I think this is more for the parent centers to support families that need more. So thank you for that anonymous question. I don't want to call out your state if that would, I think we are happy to see that our guidance has gone out in Spanish as well. And a number of states, Child Find has been, screening tools are in other languages, but we have a long way to go. And I think the message is clear. We need to continue to keep that on our front burner. Just keeping up. It's always nice to hear celebrations.
Yeah. Please know that we refer families to you guys all the time through our customer service work, whether in written responses or on the phone, particularly since we know you're right there, in the communities, in the state, with good knowledge of how things work at the state level, and can provide some additional assistance that we likely cannot. So we love being able to have you as a resource to direct families to who are in need of support.
Not seeing anything other than some kudos, and yes, it does take a village. Appreciate that. I'm going to hand it back to Jennifer Miley.
Everyone, thank you to Carolyn and Miriam and the SIPR staff and the parent-centered staff and my colleague Carmen and RTP, and of course my colleagues Brenda, JBZ, Jeanette, and Lisa Pagano. And if you guys have any questions or you want to reach out to us, Carolyn has our email. We look forward to additional time with you. So just touch bases with Carolyn if you have some more topics that you'd like us to discuss. For example, Part C dispute resolution. But anyway, have a great day, everyone. Thanks, everyone. Take care. Bye-bye. Thanks, everyone.
Thank you.